Also tonight, we have this piece from our health correspondent, Ashish Joshi.
A warning delivered from the heart of government. The COVID threat escalated to level 4. Hundreds of possible daily deaths, transmission rising exponentially. But these men striding towards Downing Street are scientists, not politicians. Their evidence is about to impact us all.
By mid-October, you would end up with something like 50,000 cases in the middle of October per day. 50,000 cases per day would be expected to lead a month later, so the middle of November, say, to 200 plus deaths per day.
Hospital admissions are rising. Older patients are becoming infected. It's why millions of people across the country are already living under local restrictions. But this could be just the start of a long and difficult few months.
So we have, in a bad sense, literally turned a corner, although only relatively recently. And I think everybody will realise that at this point the seasons are against us. We should see this as a 6-month problem that we have to deal with collectively. It's not indefinite.
Yeah, so if we go into lockdown again, that would be closing everything.
The warning from Downing Street is that the virus is not getting weaker. These words will resonate in hospitals and waiting rooms across the country.
This GP surgery was overwhelmed in March. Of course, they're going to be much better prepared this time round, but for the doctors and staff who work here, it's somewhere they just don't want to go back to.
And tell me how long that's been going on for.
Dr. Vinesh Patel has already seen a huge rise in suspected COVID-19 cases.
We've seen an increase in the patients who are contacting us with symptoms that we typically see during the winter, but obviously a lot of those symptoms overlap with COVID, and so the demand for seeing them, testing them, and giving them reassurance has increased massively. The scary thing now is that we're heading into the winter months, so all the problems that we faced back in March, it feels that it's 10 times worse now.
What we're asking for is not to rush into anything.
The scientific community is polarised. A letter signed by some of the country's leading doctors, including Professor Carol Sikora, has been sent to the Prime Minister. It urges a targeted approach instead of a sweeping lockdown.
There's also another scenario where it's much, much less. What we didn't hear today was that the number of people becoming ill and going to hospital has dropped right down.
Scientists usually steer clear of talking about the economic impacts of lockdown. Today, though, there was an acceptance that finding a balance would be challenging.
Ministers making decisions and all of society have to walk this very difficult balance. If we do too little, this virus will go out of control and we will get significant numbers of increased direct and indirect deaths. But if we go too far the other way, then we can cause damage to the economy.
The scientists can only advise. Ultimately, what happens next is down to the politicians. Ashish Joshi, Sky News.